Subscribe to our YouTube channel and press the bell icon to get the latest updates.
After about 3 months, the second wave of the COVID-19 pandemic, which had a devastating impact on the country, has finally subsided. In the last few weeks, we've seen state governments across the country lift the restrictions which had been imposed following the second surge. And as on Monday, the number of cases in the country stood below 40,000, with the number of deaths being at 723. However, it might still be too soon to make light of this situation, given that there is increasing conversation of a third wave, which is likely to hit the country in the upcoming few months. To answer the questions around the third wave and many more, we have with us today Dr. Devi Shetty, who is a renowned cardiac surgeon, founder and chairman of Narayana Health, as well as a member of the Supreme Court appointed National Task Force. Dr. Shetty is also leading the committee which has been set up by the Karnataka government to look into the preparations for the third wave. Welcome to ThePrint, sir.
Thank you. Thank you.
So, right off the bat, I want to ask you about this third wave. What is being spoken about it? When is it likely to, hit the country? Which sections of the population is it likely to affect? And because you're on the panel of the committee in Karnataka, what are the kind of preparations, is the state government taking?
You see, the two waves of COVID has taught virtually all the governments about what needs to be done. And Karnataka government is always very proactive in anticipating things and taking proper steps. And the results show that Karnataka has done well. Of course, we can always say that we could have done better, but it's with all the limitations of not knowing what the COVID consequences are, how many people will be affected, and what kind of a manifestation it will be, how fast it will spread. Nobody was aware, no one. And this is a disease, it's only a 1.5-year-old disease. There are no experts. If somebody calls that he is an expert in COVID, I somehow find it difficult to believe that nobody can be an expert in this disease, which changes its color, contour every other day. Now, Karnataka government has taken a lot of proactive measures, and we are actively involved, both private sector and the government. We hope that we will be in a much better position to manage the third wave when it happens, if it happens.
What are these preparations looking like? Because there are some, estimates as to children might be more affected in this third wave. Pediatric wards are being set up, hospitals are being equipped for the same. So is this the focus right now? Is that, managing cases among children?
See, it's not true that COVID third wave will attack primarily the children or predominantly the children, but there is a speculation, or the guess is that since children are not immunized, and during the past two waves, number of children who got infected wasn't very high, they are a vulnerable population because the virus always tries to find easy targets. So adults are either infected or immunized. So children are vulnerable only because they are not protected. So there is a possibility that the number of children who land in the hospital may be much more than what happened in the past two waves. And unlike the adults, scaling up pediatric hospital services, critical care services is very difficult. So all the governments are now concentrating on staffing the getting the beds for kids and getting the oxygen connections and all the equipments and the drugs and disposables, everything, because these are not available freely because number of children who land in the hospital are extremely small. In the whole country, I don't think we will have more than 1,000 ventilators who can ventilate a kid weighing less than 5 kilos.
Right.
So, but fortunately, what has shown in the past is that when children get infected less than 12 years, number of them landing on the ventilator is not very high, and generally they remain asymptomatic. Having said that, we cannot never predict how COVID will be. So we should be prepared for the worst and hope for the best.
Sticking to this topic of the impact of this situation on the children, your committee had recommended a phased reopening of schools, wherein you had said that the panel had said that the staff and the teachers should be vaccinated before this happens. On the other hand, the Union Ministry of Health is saying that the zero prevalence level will be a huge determining factor. So, what do you think would, how should we turn towards this decision of reopening the schools?
See, the expert committee in Karnataka never gave the date for opening the school.
Right.
It is a very, very complex decision which has a massive impact on thousands of children and families. So I don't think any expert committee has the knowledge to clearly say that you could start the school or a college at this time. What recommendation we gave is that when the government decides, after consulting all the stakeholders, to start the school, what are the things they need to do? So one of the recommendation given, we have a separate committee of experts on this aspect, which is again central, the state government committee headed by Dr. Sudarshan. So we all thought that first they should start the college, but we have never said when. Okay, first they should start the college. And all the college students should be vaccinated, with every employee of the college being vaccinated. Then we should start the college and see how it goes. Then you think about coming to the school children. That is a recommendation we gave. Yeah, but it is we cannot shut the school forever. So the COVID is not going to go away for some time. You see, it's very important for every citizen of this world to understand that when the COVID first started, all of us told ourselves that, okay, COVID has started, but it will go away. Spanish flu came, it will go away. But now we realize that there will never be a day when the leaders of the countries come forward and say that today COVID has gone for good and we can live happily ever after. That is not going to happen. COVID is not going away for a few more years. What the spikes of COVID, what we see, may not be there in the future, but it will keep on lurking, and in areas, in small towns or in big cities, it may just go up for a while and again it will come down. But generally, what killed the COVID patient is not the disease itself. It is the overwhelmed healthcare system which couldn't offer the treatment what patients needed. And also there was no vaccination. Now that vaccination is there, it is a matter of time before all the possible vaccines will be available and will be vaccinating. So essentially the entire contour of the disease and how we react to it is changing dramatically. It's a very dynamic scene.
Do you think that inoculating children should be a major focus right now?
It is a wishful thinking that we could vaccinate children like we vaccinate them for BCG or influenza or any of those, right? It's a wishful thinking, but it's not likely to happen because first thing is these vaccines have to undergo trial about the safety. Yeah. And it will take some time for, even if it is available, for the parents to accept the vaccine for the kids, right? And also the fact that COVID in children is not that dreadful disease. So there are many things we need to consider before thinking about vaccinating children in large numbers.
Okay. So since you spoke about, this, the kind of stress that the health infrastructure has been put under, another crisis that you also spoke about in many interviews is of manpower, basically. Doctors, nurses facing extreme burnout right now. So how can we circumvent this situation right now? Yeah.
See, the COVID has exposed the soft underbelly of the Indian health system. we are extremely, extremely short of medical, nursing, paramedical manpower since independence. There has never been a time when we were very well staffed.
Right.
And today, with 1.3 billion population, we are nowhere close to the required number of doctors or nurses or technicians. All these, today, unfortunately, we are not even aware of how many doctors are working or how many nurses are working. We don't have a proper data. So essentially, now the government is in the process of taking the right steps in terms of identifying what is the shortfall and trying to see in a record period of time how we can grow the manpower. But my suggestion to everyone is that every state government should have a document stating how many doctors are working in their state. And first thing is they should have a document about data on how many doctors they need and how many doctors are working, how many specialists they need in each specialties, then how many nurses they need. Then they should have a clear roadmap as how we are going to train all of them. Every state government took the stand that if we have a manpower problem, let's blame the central government. Okay, because central government is the one which is controlling. In reality, central government is not controlling the state medical manpower. Every state government has the right to start their own kind of a courses, and that course is that degree is recognized only in that state. But none of the state governments took the initiative to create their own curriculum. It is very good to say that in the whole country there are 10,500 radiologists. Supreme Court and the mandated that any doctor with MBBS degree, if he was trained for 6 months or a year, should be recognized as an ultrasonologist. But how many state governments in the country have implemented it? So the problem what we see in healthcare is lack of implementation of what they can do by the state governments, and they took the shelter in blaming others. So this is what is important, that state governments must take charge in producing adequate number of manpower. Everybody says there are no nurses. Who's stopping the state government from starting more nursing colleges? It is not the central government which is giving the permission to state government. State governments have the right to start as many nursing colleges as they want. But they're not starting. Why? Because civil society is not asking the right questions. So unless the civil society asks the right question, when they go to a government hospital, if there are no doctors, if there are nurses, they should ask the policymakers, what is happening? And that is not happening.
Sort of mitigate the current demand, you had said that we should also be looking at enlisting final year medical students, nursing students. It's something which had caused a little bit of a debate also, wherein a few doctors responded saying that these are just students and not qualified doctors. Why do you think this is a suggestion that we should be considering?
I have never recommended that the students should be sent to the COVID ward. Okay, all I was suggesting is that there are 180,000 doctors, qualified doctors who have finished their internship, waiting for the NEET exam.
Right.
Okay, now only 30,000 of them will get the PG seat. Remaining 140,000 or 50,000 student doctors do not get the PG seat. So we should see how we can incentivize them to come and work in the COVID ICU because they're fully qualified doctors.
Right.
That is one area. Other area is there are nearly 80,000, 100,000 doctors who have qualified from overseas medical colleges. And they're all waiting for their the exam for their degree to be recognized in India. And if they're incentivized to work in COVID ICU, they'll be very happy to work. So these are the workforces which we have available. When there is a crisis, we should create a floating group of doctors. Similarly, the nurses, every year over 2 lakh nurses graduate from nursing colleges. They should be incentivized to work in COVID ICU. We can't keep on flogging the same horses which have been flogging for the last 1.5 years in the COVID ICU. They are tired. Good number of them are infected. We need a fresh workforce. So this is what, and this has been done in Karnataka. They have done this by getting these young doctors to, I'm sure many more state governments will follow.
I also wanted to touch upon the topic of these post-COVID complications. So we've seen a whole range of it in the past year, starting from diabetes, cases of diabetes, respiratory issues, etc., which has also led to deaths in a few cases. So how do you recommend these kind of post-COVID ailments be managed?
This is going to be a great challenge in the next few years for healthcare, because we have added a different set of diseases which can affect your brain, your heart, and the rest of the body, and it has a devastating impact. Now, this is going to be a huge burden on the already overburdened health system of the country. So it is sad that very few diseases affect multiple organs the way COVID has affected. And believe me, we have no idea what will emerge after 1 year or 2 years, what new disease will manifest because of the COVID impact on these vital organs. It is going to be a huge challenge. And I wouldn't be surprised if there is a separate specialty emerging as a COVID specialist, because it's very complex, very difficult, it's like but one thing what we have noticed is most of the long COVID syndrome, what we see, generally patients get better by themselves. Yeah, it looks like a self-limiting disease, but we have to wait and see.
And lastly, the last question I had was about one of the recommendations. You were part of the Lancet Commission, and one of the the commission itself had made 8 recommendations. One of which was the centralized procurement of vaccines, which again has happened, as we know, in the past month. So since then, we've seen the number of doses that were administered in a day remaining between 40 to 60 lakh around that time, still not hitting the target of 1 crore. So right now, what are the kind of bottlenecks have you kind of identified in the vaccination program as it stands right now?
See, today the debate is about vaccine availability.
Yeah.
But you'll be surprised that it is really not the vaccine availability which is going to be a challenge. I know there is a problem right now, but I am optimistic that vaccine will be available to everyone within a month or 2 months. Right. That's not a problem. The problem is a vaccine hesitancy, which we are not addressing. Believe me, this is going to be the greatest challenge in India and rest outside India as well. It is and it is not just the uneducated people who do not want to be vaccinated. It is educated, smart people who have their own arguments. It is very sad because if you ask me, it is not vaccine against COVID. It is a vaccine against death. That is how vaccination is important. Right. At the peak of COVID, we had close to 700 patients in one hospital where I am sitting. 700 patients with COVID. And our doctors kept telling me from the beginning that they haven't come across many patients who landed in the ICU who had 2 doses of COVID vaccine. That is the power of protection given by the COVID vaccine. And I get disheartened when educated, smart people argue against vaccination. Not only that, they convince others that vaccination is not that important. This is going to hurt our country, because when you're not You believe in not vaccinating. Fine. It is not like polio or other disease where you don't vaccinate, you may get the disease. Here, every infected person without vaccination can infect another 4 or 5 people who are innocent bystanders. So imagine a situation, you're working in a shop where hundreds of people come in and out and you don't believe in vaccination and you're infected, you're going to infect all those innocent people who came to your shop. So it is very, very important that some governments have already taken the step saying that any establishments where running the business, where large number of people walk in and walk out, if you want to work in that establishment, you have to vaccinate yourself. And I feel this has to be implemented across the country. If you want to believe in not vaccinating, stay at home. But don't go to the place of work and infect other people. So this is, I'm not saying if you're vaccinated, you won't get COVID. You can still get COVID, but strong possibility you won't land in ICU. So it is very important that we need to come up with massive educational, massive educational effort to educate everyone why they should vaccinate. Yeah.
And so I wanted a clarification on the first question that I'd asked. So is there any tentative time that you're looking at about this third wave? Is there any discussion so far around it?
First thing is, whether there is going to be a third wave, there is a possibility there will be a third wave. If it has to happen, there is nobody knows when it is going to happen. Likely that it may happen in August for the next 6 months, 8 months, anytime. Yeah. But my gut feeling is that it will happen, but it won't be as bad as the second wave. But I always inform, in all our discussions, I keep saying we should be prepared for the COVID third wave to be at least 30% worse than the second wave. We should be prepared. Okay. And we know most of the surprises COVID can throw at us. And we should be prepared.
And lastly, beyond this scaling up of the pediatric units itself, what other recommendations, specific recommendations have been made about the third wave?
It is very, very important that we must make our government hospitals, public hospitals vibrant. We have extremely well-equipped government hospitals, but very little is happening there. Because if there is a surgeon, there is no anesthetist. If there is a surgeon and the anesthetist, there are no nurses to take care of the patient. If all of them are there, there is no radiologist to diagnose the problem, or there is no blood bank. So it is very, very important that every state government should have a checklist, which every government hospital should publish on a daily basis in a mobile phone app. Simple thing, like how many surgeries were done, how many were done under general anesthesia and spinal anesthesia, how many patients came to their OPD, how many x-rays, how many ultrasound, how many blood they have collected in the blood bank. Simple task. We have to start doing this right now, and that will that will display what is happening in a government hospital. We do this in all the private hospitals. We run a chain of hospitals. On a daily basis, we know how many patients came to the OPD, how many surgeries were done, how many angiograms were done. Same thing has to be done in a government hospital, because patients may not pay for it, but we pay for their care. We are taxpayers, we are paying. So there has to be some kind of an accountability coming from the government hospital. And unless the government hospitals becomes vibrant, not only COVID, for even post-COVID, we will not be able to change the way healthcare is delivered. Depending on the private sector for managing the healthcare of the whole country, we are making a big, big mistake. Because irrespective of how much I reduce the cost of a heart operation, half the country's population cannot afford it. Okay. So we need to have a place for them to get the treatment comfortably.
Okay, sir. Thank you so much for coming and for answering our questions.